Hello and welcome. This is a brief navigation of a patient survey. What does the Fahr's community need? And this is to support the World Parkinson's Congress poster that we've submitted with the same title. I think just as a very brief summary, Fahr's disease we present as a neurodegenerative disease which involves idiopathic basal ganglia calcification without a secondary cause, whereas Fahr's syndrome is a much broader term that's used to encapsulate a range of conditions that don't have that genetic cause. So disease is genetic, and we propose that syndrome is broader, where it might be secondary causes. It is progressive, usually involving the cerebellum. Patients often will experience neurological, psychiatric, and cognitive features. Movement disorders, Parkinsonisms, balance gait issues, headaches, dysphagia, TIA-like episodes, and on the psychiatric side, commonly depression, anxiety, psychosis, in a couple of cases schizophrenia, and cognitive, usually intellectual disability or mild cognitive impairment, and dementia. So our study was undertaken in 2019-2020, and it was a single method cross-sectional piece of research aiming very much to find what are the common themes that some of our community, that Fahr's patients face, but also how they were diagnosed, if they were diagnosed, what methods were used, what are the symptoms, how are those symptoms managed, and then if a national referral service for people with Fahr's disease in the UK would be appropriate or not, and if so, what would they expect of that referral service? So the data was collected using JISC online surveys, and there were 9 pages of the survey of the questionnaire to go through. First page being the participant information, through to the eligibility check, symptoms, diagnosis, treatment. And there were 17 questions arranged between open-ended and closed-ended questions. I think the key finding here to present is that there was unanimous acceptance or indication that there was a need for a dedicated referral service in the UK for people with Fahr's. The first figure, the reported symptoms of Fahr's patients, shows that there are 23 broad categories that Fahr's patients experience, and significantly here, 8 people with movement disorders was the top one, memory, pain, poor coordination, poor balance, speech issues, tremor, all came out as some of the highest occurring symptoms with people with Fahr's disease. And all but one person had had a CT or MRI scan as part of their diagnosis. It would be interesting to break that down further to determine the percentage of CT to MRI. In most cases, it's not unsurprising that a specialist, so a neurologist or a geneticist, had been involved in the diagnosis of the person's Fahrs. There were 20 people who initially took part in the study and 2 later withdrew their data. And whilst this seems quite a small number, it's still the largest piece of research at the time undertaken for the Fahrs community, or the most number of respondents, most definitely. You can see as well that there's a fractured approach to how Fahrs is currently being managed. Here, there are a range of different medications that Fahr's patients take to manage their symptoms. And 62% of participants were taking medication of some form. The figure below shows broadly the management was through medication. That's 8 people indicated that there, so there's a bit of a mismatch between respondents on the medication list and then medication as a mode of managing. So also that piece of awareness is quite important. No management appeared as one of the highest indicated responses, and likewise a 12-month checkup with neurology. So it was encouraging to see how that all patients felt there was a need for a dedicated national Fahrs referral service to be the beacon of diagnosis, management and assessment of the disease, but also around providing answers to questions around what might it be like to live with Fahrs? How can I work in my day-to-day job with Fahrs? And a range of other specialist interventions and signposting. Interestingly, 50% of participants felt that they should be seen within 3 months of a referral being made to a national referral service, and 83% expect to be seen within 12 months. So there might be some managing expectations there, and particularly managing expectations of frequency of follow-ups. Some of the participant quotes that, just to draw out, kind of mirroring what I've said, is how much worse is it going to get and when? As there's no cure and the future is uncertain how the condition will, or if it deteriorated, how will it affect us? How can the service and the charity help us cope? So some very key questions here, and it feels like the National Referral Service, therefore, is an important part in coordinating care of Fahr's patients and providing information for their families. It's about providing specialist support to local clinicians, but also around there being a first cohort of patients that can be used for further studies to help with involvement in the development of NICE guidance, so that there are minimum care standards in the UK which could then be replicated in other health systems. And it's about connecting patients to combat loneliness, one of the key areas of the UK rare disease framework. So many of these findings, as I've said, do mirror what we see for other rare diseases. And what we have here is an opportunity, and indeed I'm pleased to report that a National Fahrs Referral Service on a local level within the existing Movement Disorders Clinic at UCLH has been set up and is available for clinicians to refer to. So that's Professor Bhatia's clinic, clearly designated Fahr's referral service, and we're going to undertake more work looking at clinical patient outcomes. We've already started that. Looking at setting up a formal integrated clinic, working with other rare diseases, and I'm going to leave that there. Please do feel free to reach out to myself or Dr. Amit Butler. Thank you.